Thank you so much. It's really great to be here today. And I'm proud to be the second of two candidates who felt like it was in their priorities to be here talking to students. And I want to, by the way, congratulate you on your new status as university. Well-deserved, well-earned, somewhat overdue, I might say, and congratulations on that. But especially I want to commend you for being here today and making your voices heard. And I must say, this is unique to Bridgewater State University, that you are the only college or university that I'm aware of which has actually established a forum that gives students a voice, and that isn't just the candidate talking to you, but the candidate listening to you. And in my view, this election really is about you, because you are our future, and you are our current. You are now as well. And what's happening, I think, at the level of the state to our public colleges and universities is really a reflection of misplaced priorities. And I think that this is the time for us to be looking at where are those priorities and why has education funding been cut? Almost $600 million if you adjust for inflation over the past decade. That we've been cutting public higher ed, we've been cutting local aid, which has been slashed by almost 50%. We've been cutting our elementary and secondary education. Key pieces of health care, seniors, for example, are paying 30% of out-of-pocket income to pay for their pharmaceuticals, and yet our administration has been cutting support for the senior pharmacy program. I myself became active as a physician working in healthcare for many years, for 25 years really, trying to give people the care that they need in a very broken system that just keeps getting more broken. And I know that students now are often required by the mandate to buy healthcare that they can't quite afford. Are people in this room, did you have to purchase your own health insurance? I've been talking to students at Dartmouth, UMass Dartmouth, last week, who actually had to take out loans in order to cover their mandated health expenses, excuse me, in addition to the loans that they've had to take out to cover their education. And Massachusetts, unfortunately, has the distinction, you probably know, of cutting higher education more than any other state over the past 5 years. Massachusetts leads the nation in cutting higher ed, and we're now number 46 out of the 50 states in per capita support for higher education. And what I learned as a physician in healthcare was that there was so much we could do, but it was very hard to get politicians to listen to the solutions that are actually right there within our reach that could bring down the cost of healthcare, that could make it possible for all of us to have affordable, quality, and comprehensive health insurance. And so I learned as a doctor, very frustrated in this system that just kept getting closer and closer to collapse, that if we really want the health care we need, if we really want the affordable higher education, if we really want to get good jobs back to the Commonwealth, that we need to basically get our government back so that it's working for us, the everyday people. And my opponents in this race, just in brief, are very much from the inner circle of business as usual on Beacon Hill. And if you look at what business as usual is doing, it is certainly delivering for those who are doing well. We know, for example, that the 400 wealthiest families across America quadrupled their wealth, they quadrupled their wealth 4 times over in the past decade, whereas most people are struggling to just make ends meet and to keep from going off the cliff. And in Massachusetts, we've seen 300,000 that are unemployed, about an equal number now that are employed but can't quite make ends meet with the jobs that they have. skyrocketing healthcare costs that are crushing small businesses in cities and towns alike, skyrocketing bankruptcies and foreclosures, and students who are really struggling. I know at Dartmouth, UMass Dartmouth, I was talking to many students who are basically $50,000 in debt just from their student loans. Add to that their healthcare debt, and then, you know, on top of that, you're coming out and we don't have jobs. So mostly our business as usual candidates are talking about more of the same and more of giving away the store in our tax base to those who are already doing well. Them that's got is getting, and everybody else is sliding further and further behind when there's no excuse for it and there's no need for it. When they say there's not enough money, what they mean is there's not enough money for you. You may know who there is enough money for. For example, the governor is spending $200 million this year building office parks and shopping malls, as if that was going to create jobs or jumpstart us out of our recession. You know, not a prayer. We know that there are high vacancy rates already and that building more is not exactly the solution to jumpstarting new jobs. $300 million every year for the Raytheon and Fidelity tax cuts, which you may have heard about. That's $300 million every year, which was promised in exchange for jobs which were going to be protected or created, but they weren't. The jobs were not created, and the ones that were there were lost to the tune of thousands, yet we continue to pay out $300 million every year for the deal that got broken. $150 million now for the film industry, for tax credits for the film industry, $150 million that could go a long way to restore financial aid, for example, for higher education, which has been cut by over 50% over the past decade, at the same time that your tuition and fees, you're probably aware, have doubled. Yet we're giving away $150 million now to the film industry, and they're largely selling these tax credits now on the open market. So that's not exactly jump-starting our economy or jobs. And the list goes on, including $9 million that the governor is trying to obtain for the Kraft family billionaires to connect two of their private businesses, as if that was going to also translate to more jobs for us, and as if the Kraft family couldn't afford $9 million to build their own bridge. So this is the point, that when they say there's not enough money, what they're really saying is that there's not enough money for you. Because at the same time that we are saying no, and the governor talks about the hard choices he's been making to cut home care for seniors who want to be able to stay in their home, to cut child care for needy families, cutting tuition support for higher education. The governor talks about those as the hard cuts, to which I have responded, well, what about making the tough choices of taking back some of that money that was promised for jobs that were never created? Let's put that back into the budget and spend it on real economic development, which is in this room and in this university. We know that the real fundamentals of economic development are an educated workforce. And for every dollar that we spend in public higher education, we get back about $8 or $9 in increased economic activity for the state. What's wrong with this picture? Why are we spending the money where it's not helping our real economy and our future generation, and instead we're turning out a generation of students who are up to their ears in debt with no prospects of job? So for the first point that I want to make is that there are resources, and they should be spent where they really benefit the Commonwealth. And number one priority for benefiting the Commonwealth is to fully support our colleges and our universities and our community colleges. Above all, this is where we really invest in the future and where we really create the infrastructure for an economy, for a healthy and vibrant economy, and training that workforce so that we can move the economy. You are the engine, and you should be the first priority. Let me talk about a couple other solutions that are being neglected. When we talk about the resources that are there, part of it is the money that's being squandered. And this year, the legislature enacted another big tax cut for the wealthy and for large corporations. And this was another $140 million in addition to all the others. And I might add, there's $1.7 billion in what we call economic development tax incentives. Things like that $300 million for Raytheon and Fidelity. You add them all up, it's $1.7 billion. That's not to say all of it is a waste, but a lot of it is. And there's no more important way to develop our economy than by putting our tax dollars into the development of our workforce and the support for our colleges and universities. But in addition to this money which is being misspent, there's an enormous amount of savings that we could be recouping. And this is from my area of special experience and interest, and that is in healthcare. And there are two reforms that healthcare badly needs that would produce a huge amount of savings, a staggering amount of savings. Anybody know how much we're spending on healthcare now as a state? Any guesses? If you add it all up, it turns out to be 50% of our state budget. It's absolutely staggering. 10 years ago, it was 35%. It's now 50%. So this is a lot of why, you know, we're paying money, but we don't have it to spend, you know, and why higher education, for example, has been cut almost $600 million in inflation and adjusted dollars over the past decade, because a lot of it's getting gobbled up by healthcare. So there are two reforms that could really cut those costs, and one of them is the massive, wasteful health insurance bureaucracy, which eats up, nationally, it's about 35% of the healthcare dollar. In Massachusetts, it's less because we have a nonprofit structure rather than a for-profit structure. So at any rate, it's more like 12 or 13% here in Massachusetts. But apply that to $14 billion, and that's a huge amount of money. You know, it's potentially as much as $1 billion or more that we could be saving every year right off the top, right out of the starting gate, if we had a streamlined, simplified insurance bureaucracy. And that's what we call Medicare for all. And Medicare is actually a good example. They spend like 3% on administration as opposed to 12 or 13% on administration. So by moving to a so-called single-payer system, we can save certainly hundreds of millions of dollars right off the top. You may know that, you know, if any of you are involved in healthcare, that you see physicians and nurses and providers and hospitals spending a huge amount of time and money trying to figure out who's your insurer and what do they pay for and which pharmaceuticals are covered and what doses, and there's just a mountain of minutia that health providers and institutions have to manage. And this is what gobbles up so many healthcare dollars. Just to contrast, Mass General Hospital is very similar to Toronto General Hospital. They both have about 900 beds, similar kind of patient mix. In Mass General Hospital, it takes almost 300 people to manage their insurance payments. At Toronto General, it takes 3 people versus almost 300. That's where the big savings should come from. And if you've had trouble finding a doctor lately, one of the reasons is that they are fleeing Massachusetts, and one of the biggest problems is just this insurance bureaucracy, which drives providers crazy like it drives ordinary people crazy who are trying to get their health care bills paid and, you know, keep their coverage and all that. So this is a huge solution which keeps getting taken off the table, that if we just went to a streamlined single-payer system, that we could save hundreds of millions of dollars right off the top. We could also start negotiating for what we call bulk purchasing, where we're buying the medications as a single state insurer, which brings down the cost enormously. So a lot of people have trouble covering their pharmaceuticals these days, their medications. There are all kinds of loopholes in the insurance policies that make it really tough to cover the medicines that you need. It doesn't have to be that way. And when they say that that we don't have the right political climate for it, that's a sign we need to change the political climate so that it's working for us and not for the pharmaceutical companies. And then one other thing about healthcare, we look at healthcare as what's happening in the doctor's office, which is largely get your prescription and go back out. Whereas really, we know that the basics of health has an awful lot to do with what you eat and whether or not you have an active lifestyle and all that. And it's one thing to tell people in the doctor's office what they should do, but you need to have the infrastructure for health in the community. You need to have healthy food in the schools, in the cafeterias, farm-to-school programs, farm-to-hospital, farm-to-healthcare, and so on, so that we're eating healthy food as just part of our daily life, and you don't have to go out of your way to find it, and you don't have to pay big bucks to buy it, because we subsidize sick food. We don't subsidize healthy food. We make healthy food very expensive. And if it was the other way around, we could create the cost incentives so that more people are actually eating a good, healthy diet. Because we know that 75%, most of government dollars, that's your tax dollars that are spent on healthcare, are spent on diseases that could be prevented at a tiny fraction of the cost. And we're all kind of teetering on bankruptcy from the outrageous costs of healthcare. And it doesn't have to be that way. If we had cleaner air, if we had bike paths that dovetailed with buses and trains and light rail, and we had a public transit system that allowed us to have a more active form of transportation, it was just part of life, was walking to the T or walking to the bus or biking there and you know, biking in between. When you integrate activity into a community's infrastructure and transportation, then amazingly, people tend to get healthy without having to work at it so hard. It's just part of daily life, especially for food. And clean air is obviously a big part of this too, because we know that one of the big drivers for the asthma epidemic is just, you know, it's dirty air, it's the traffic that we're surrounded in. So, getting to the last point here, which is that how do we create jobs? How do we make sure that when you graduate that you've got jobs to plug into? I want to make a suggestion. Right now, the governor, is spending $200 million on office parks and shopping malls. Well, instead, how about we create a revolving loan fund for small businesses and cooperatives to start up in these areas of green jobs, like conservation efficiency, weatherizing homes, deep energy retrofits, producing the technology for that, the solar panels and the solar hot water heaters and stuff like that, and the electronics that shut off your lights when you're not in the room or adjust your heat, things like that. Those jobs pay for themselves out of the energy savings. So if we're using that $200 million to create small businesses that are doing the green energy, that's a win-win. And we can also use that revolving loan fund so that consumers and homeowners can undertake those weatherization projects. And they can pay back the loan from their savings in their reduced energy costs. So you have basically a revolving loan fund that keeps regenerating itself and enabling more businesses to start up in the area, again, of clean energy, also healthy food. There are so many, you know, community farmers markets, and the farm-to-school programs and so on that are waiting to expand because people are excited about this stuff. The food tastes good when it's local. People like it. It creates jobs, both the farming and the agriculture community, but also the food processing, the delivery, and the creation of various programs to get the food into people's hands. So there's a whole universe of jobs to be created in the healthy food economy too. And a third one I'll mention is the recycling economy, because now we throw away a lot of stuff, about 90% of the waste stream, is actually useful material, good resources. So by recycling it and remanufacturing it, we create manufacturing jobs where we're starting with free material, basically free raw materials taken out of the waste stream. We have to pay to get rid of the waste, right? And a lot of it's going up in the air in incinerators, which makes the air even dirtier, or landfills, which are contaminating our water supply. Instead, we can get rid of the waste stream. Instead, put it into productive use, creating jobs. So these are all proven strategies for creating jobs that basically pay for themselves. And another category, of course, is public transportation, even things as simple as bike paths and safe sidewalks. And the beauty of it is that it not only creates jobs that pay for themselves, it also makes us healthier. Because when that food is available, and you gotta get your food fast, you can actually get healthy food fast, instead of, getting really lousy food fast that's making a lot of us sick. We get healthier. And when we're walking or biking to get to the T, we get healthier when we're not surrounded by all the commuters who are in their cars, and we can actually commute in a more active way. And remember, it's cleaning up the air because we're using a whole lot less energy. It's not polluting our water supply because we're not putting the trash into the landfills. So the bottom line is we get healthier, we reduce our energy costs, and we put people back to work in jobs that pay for themselves. What's not to love about that? And we've looked at some of the numbers and seen that we could probably jumpstart easily 50,000 jobs, maybe more like 100,000, if we simply had, the little bit of resources to get this jump started, like that $200 million that the governor is spending on shopping malls. We could actually start jump starting a healthy green economy. And the bottom line is that when we actually get healthier with this, we start to recoup some of this $14 billion in our tax dollars that's spent on diseases that we don't need to have if we're able to eat healthy food and able to get exercise and breathe clean air, in a nutshell. So I want to leave time for discussion and to hear your thoughts about, what are your concerns, what do you see as solutions, what questions you have for me as a candidate. I'll just say one more thing, and that is, I'm the one outsider in the race. I'm the one person who's not a part of the Beacon Hill machine. I'm the one person who doesn't take money from lobbyists or from any corporation that hires a lobbyist. So I'm not part of the whole pay-to-play Beacon Hill culture that people are fed up with. You ask voters what they want. They really want something different. They want something that's not part of business as usual, not part of this big money political machine that is delivering for those at the top and really slamming just about everybody else. And it's clear, that when you go into the voting booth on November 2nd, if you vote for more of the same, you'll get more of the same. Now, people are being told all kinds of reasons about why they should not go outside the box. But, I would just remind you to look at your experience and see if we seem to be going in the right direction. Does it make sense? Wall Street had its best year ever, and CEO, executive bonuses are maybe on average 40% higher than ever. Now, you could say, well, that's Wall Street, that's not Massachusetts. But we know, in fact, that what's happening nationally is also happening in Massachusetts, and in some ways it's worse here. Massachusetts is fourth from the bottom in this incredible gap between those at the top and everybody else. Massachusetts is number 4, and if you want the references on that, I can give them to you afterwards. So, things aren't going our way, and they seem to be accelerating, in fact, in the wrong direction. We know that in the last period of economic growth, over the last 6 or 7 years or so, that most of it went to the top 1%. The top 1% is actually making out like bandits, and we know that big money is a big driver. It's bigger than ever in politics as usual. And the floodgates have really opened this year with the recent Supreme Court decision that, you may have heard of this so-called Citizens United that basically said corporations can spend whatever they want in the form of these independent expenditures. So the lid has really come off. As money has concentrated at the top, so has political power. And that's translating into what we see rolling out in your daily lives, that students are graduating from colleges and universities that are really struggling to keep quality together, and they've done a heroic job of doing that. But, part of the bottom line is we don't have the funding for students, and the costs have skyrocketed, and we have what's almost a generation of indentured servants coming out of our school system where there are no jobs. So this isn't looking good. Healthcare, the costs just keep skyrocketing when we actually have a good solution. We could cut those costs. We don't have to be increasing them. And why cut them by shifting costs onto consumers who are overwhelmed already when we could just cut the insurance bureaucracy, which doesn't help, it hurts. This is not a useful thing. That's what we should be cutting. But they don't want you to even hear about it, which is why they've really worked hard to keep my campaign out of the debates and out of the news. They don't want to cover it. It's interesting, because I was in the race in 2002, and at that time I was in the debates until I was voted winner of one of the instant online viewer polls in the WBZ debate. At that point, I got taken out of the debates because it was clear that the public has too much resonance with the kind of things that my campaign is talking about. Now, since 2002, we've had open debates. And we've had all kinds of fringe candidates in those debates, and nobody complained. That was part of democracy. I find it interesting that now I'm back in the race, suddenly we have to close off the debates again. Maybe it's because it's dangerous to have a doctor talking about how we can fix healthcare. I don't know. I can't explain it. I'm just noting it's an interesting coincidence that we've managed to have open debates and feel just fine about it until this year. And now suddenly there seems to be a rather concerted effort to keep me out of the debate again, because I think the things, put it this way, I have the liberty to talk about things that you can't talk about when a lot of your funding is coming from the pharmaceutical industry. And where are the other three candidates today? They are all talking to the Biotech Council. They're all talking to the pharmaceutical industry today, as if they weren't making enough profits to start with. So, this is what we need to fix, in my view. It's not just fixing one bill, it's fixing the system and basically taking our government back so that it starts working for us, the ordinary citizens of the Commonwealth, the everyday people who are falling further and further behind. And it's really important to think about voting for yourself. Don't follow your marching orders, vote for yourself, because when you go into that voting booth, if you can't bring your values into the voting booth, everything you do outside the voting booth doesn't count for very much. So we need to start making ourselves count as a voice for public higher education, as a voice for affordable health care, as a voice for secure, good-wage jobs that are here for the long haul, that aren't going to be offshored and outsourced and downsized, but they're here serving our essential needs, so they're not going to go overseas. It's really important to vote for ourselves. Those solutions are there. If we don't make ourselves count, there's not much hope that we're going to get those solutions. But even if my campaign didn't win, but we were a portion of the vote, it's a heads up to Beacon Hill that they need to start listening to us. They need to start listening to our voices. We're not going to be silenced and muzzled. That being silenced is not a solution. You've got to start, from a democratic dialogue in order to start moving forward. The minute we begin to take our government back and get it working for us is the minute that we can actually start solving these problems. The problem is not the problems. The problem is the system that shuts us out. So with that, I want to thank you very much for being here today, and I want to just open the floor to your questions or your comments. Thank you.